So let's move on to the anti-helminthic agents. We'll start off with the nematodes. So the nematocidal agents start off with albendazole. It's probably first in alphabet, but it's also first in choices. It's a very, very good agent. It inhibits microtubule assembly, which is essential for the structural stability of the organism. It kills the ova or eggs in Ascarius and these other agents. It is also going to kill the larva in Ascarius and Cysticercosis, which is also called the pork tapeworm. It is larvicidal in hookworm, and it's also larvicidal in hydatid disease. So we use this agent in a number of different types of infections that are listed there. In terms of toxicity from this agent, because the agent is used for such a short duration of time, toxicity is really quite rare. Sometimes we'll see a reversible drop in white cell count, and sometimes we'll see a short-term rise in liver enzymes with prolonged use, but the times that we actually use this for prolonged usage is really quite rare, so it becomes mostly a non-issue. Diethylcarbamazepine is quite an interesting drug. We actually use it to immobilize the microfilariae by an unknown mechanism, and it's used in eyeworm. So this is actually an image of an eyeworm. So you can actually see them in the sclera, in the iris of a patient. It looks like a white line, and it actually moves around. It's actually quite a horrific thing to see if you've ever seen it live. Toxicity to this medication, reactions to proteins of dying filariae include fever, rash, and ocular damage. So it's not so much the drug itself that's causing the toxic reaction, it's the fact that when these filariae are dying, those breakdown proteins are causing all kinds of reaction, and that's where you run into trouble. Ivermectin is another well-known agent. It's a nematocidal. This is cutaneous larva migrans, and you will see this in your practice at some point or another. These are worms that are actually under the skin. It's one dose. Ivermectin is one dose. It intensifies the GABA neurotransmission in the nematodes, and the nematodes become spastic and immobilized, and they can't feed, they can't do anything, and they die. We use it in cutaneous larva migrans, strongyloidiasis, and filariasis. Toxicity to ivermectin is quite rare. Remember that the actual toxicity to the drug is almost non-existent because it's just a single dose. Where you get the toxicity is from the dying worms. And so the agents that are being released from the dying worms include fever. The side effects include fever, rash, and ocular damage if it's in the eye. Now, this disgusting picture is an infection of ascariasis. This was removed from a 4-year-old child who ended up having a bowel obstruction, and they couldn't figure out why, and they find out that his bowel was full of these worms. So mebendazole is the treatment for this. It's absorbed minimally, so less than 10% of this agent is going to be absorbed from the bowel. It inhibits microtubule synthesis, and it also inhibits the glucose uptake in these nematodes, so they die very quickly. It is the primary drug for ascariasis, pinworm, and whipworm, and it is the backup drug for visceral or tissue larva migrans. Thiabendazole is another nematocidal agent. It's a structural cogener of mebendazole. In terms of how it's working, it is absorbed systemically, and it has much more systemic side effects than the other agents. It works through inhibiting microtubule synthesis and glucose uptake in nematodes. It's an alternative for systemic affections, things like strongyloides or trichinosis, which are the adult worms. In terms of toxicity, GI irritation is quite common. You can also get intrahepatic cholestasis, liver failure, and in terms of neurological symptoms, you can sometimes get headache, dizziness, and drowsiness. A drop in white count or leukopenia is common. Hematuria is something that we have to be aware of and can occur, and allergic reactions, not just to the dying organisms, but also to the drug itself, are also present. You can also get a Stevens-Johnson syndrome, which can be fatal. We're not entirely sure if this is due to the drug itself or if it's due to the dying organisms. We haven't quite figured that one out yet. At any rate, be quite aware that this is a potential problem with this agent.